Major new study out about the benefits of taking aspirin for cancer patients. Taking just one low-dose pill a day may reduce the risk of deaths from cancer by up to 20%. And Dr. Richard Besser is back with details on this. Could help some people here. Yeah. Very exciting, though.
This is a very exciting study that just came out. What they did was they combined data from 8 studies that were done to look at whether aspirin prevents heart disease. And they said, well, is there something we can look at here in terms of cancer prevention? And when they combined studies, the data from these studies, half the people had been assigned to take aspirin and half not. They found that those people who took aspirin had a 20% reduction in risk of dying from cancer. And this covered a wide range of cancers, gastrointestinal cancers, esophagus, lung. What they found, for every 46 people who took aspirin, 1 life was saved. And that's pretty incredible finding. Pretty outstanding.
It truly is. So how long, Rich, were they taking the aspirin and how much?
Well, a baby aspirin a day was enough, but you had to take it every day for at least 5 years. They saw no effect during those first 5 years because cancers were probably already forming. But after 5 years, there was a marked difference in cancer death.
You and others have often talked about there are some side effects, though, to taking too much aspirin.
Yeah, so you want to make sure you're in a group that should be taking this, because aspirin can cause bleeding, it can cause stroke. It is not without risk. So you have to talk to your doctor about whether the benefits for you outweigh the risks.
And what exactly is it about aspirin?
Well, there are a few theories out there. One is that aspirin may kill some of the early cancer cells that are forming. It may interfere with an enzyme that's a cancer promoter. There's a lot of work going on in the lab to try and answer that specific question.
Because in essence, it's an anti-inflammatory, and doesn't that
That's right.
Where some cancers
inflammation is part of that. It may also assist in some way with DNA repair of cells that are damaged that may go on to form cancers. It's really important to understand the mechanism, because that may lead to other treatments for people with cancer.
That's so key about studies like this, too. All right, Rich, thanks so much.